Then, if you've been watching the daily press conferences or Prime Minister's questions this week, you will have heard the name Sir David Spiegelhater. He's a statistician who's advised the government's SAGE committee on Covid-19 and is much quoted by ministers about the difficulties of making international death comparisons. I spoke to him just before we came on air and asked for his best estimate of how many people in this country have had Covid-19.
We can do some very rough back-of-the-envelope sums. We've had maybe, 35,000 deaths from Covid-19. People would say that the infection fatality rate, that's the proportion of people who get infected to go on to die, is on average probably less than 1%. But let's say it's 1%. That multiply those up, which I'm sure you could do in your head, you get 3.5 million people infected in this country with the virus, and that looks like that's a minimum. But of course, it could be much higher than that. People say the infection fatality rate might be half of that, which would mean there'd be about 7 million people, at least in this country, that have been infected. And it is extraordinary. And some people are claiming half the country's been infected. It is extraordinary that we don't know these basic facts yet. And we've heard now from Ian Diamond, the head of the Office for National Statistics, that they have finally got asked to do a proper survey. April 17th, they finally got asked to do it. And we're going to start getting the results, looks like this week, of how many people have got it and how many people have had it. And I think it's extraordinary that we've had to wait this long for this most basic information. And I think that's the one bit of criticism I am willing to make about the government, is the fact that the testing the development of the testing has been so delayed.
So I gather the most useful figure probably at the moment is the number of excess deaths per week or per month at the moment. What can you tell us about that?
Well, I think that is the most useful figure to look at. And if we look at over the last 4 weeks of the data available for the Office for National Statistics, which is the reliable source of information, goes up to just April the 24th. So this is still 2-week-old data. We can see that instead of over those 4 weeks, with the 42,000 deaths we'd normally expect at this time of year, in fact, we observed 79,000. That's nearly double. That's 37,000 extra deaths. But only 27,000 of those had Covid-19 on the death certificate. And that leaves about 10,000 extra deaths, running at about 3,000 a week, which are kind of unexplained. And this is the mystery. What has caused these extra deaths? And they're undoubtedly there, an undoubted spike in non-COVID excess deaths. Now, some of them will be under diagnosis, where the doctors were not willing to put it on the death certificate. But Sir Ian Diamond last week in your programme was quite clear that he was attributing much of these to what's called the indirect deaths, or the collateral damage, the damage caused by the disruption to the health service. And this is so clear when we look at the data from care homes and at home and people's homes. There's been a massive shift of deaths from hospitals into care homes and homes. And that is not necessarily a bad thing, that people can die in more familiar circumstances, but there's also a lot of additional deaths happening out of hospitals that we wouldn't have expected at this time of year. More than half the deaths in care homes, which are running at 3 times the normal rate, are not being labelled as COVID. And it seems to me this is unbelievably important. These are just short-term, immediate deaths due to people not going to hospital, not calling the ambulance when they're ill, and so on. And that, of course, is let alone the damage that's being done in the longer term by the lack of chemotherapy, radiotherapy, elective surgery, and so on. The disruption to the health service is, I think, when we look back on this, will be seen as a massive issue.
Now, you had a slight run-in with the Prime Minister last week when you criticised him for quoting you in terms of the uselessness of international comparisons. So let's hear your actual view.
Okay, my view. I wrote an article for The Guardian because I'd got so fed up with this sort of, I think, rather media-based competition about who's top. Is it Britain or Italy? That's the worst. And I just wanted to say that because of the enormously different ways that different countries were reporting their data, that is a completely factious exercise to do a sort of Eurovision between who's the worst in Europe. But I should have made much clearer that what I was talking about was the comparisons between essentially the bad countries in Europe, UK, Belgium, France, Spain, Italy. I was not saying, that we can't make any comparisons at all, because clearly it's important to note that we, as that group, is way above, in terms of their mortality, above a group like Germany, Austria, Portugal, Denmark, Norway, who have low fatality rates. If only to say that what's happened in this country is not inevitable. It doesn't mean it had to happen. And I wasn't very clear about that. And then I found that my paper was being quoted by ministers to support the claim that we can't make any international comparisons. And I thought it'll go away. But finally, Boris Johnson used this in a response in parliamentary questions. And I felt forced, and my colleagues encouraged me to actually go public and say, please don't do this. This is not what I meant. Don't use this to make this claim that we can't make comparisons. And I tweeted that out. And it's my one and possibly only viral tweet with over 10,000 retweets.
So you said it wasn't inevitable that we had that number of deaths. And that then leads to, are we talking about policy, or are we talking about the clustering of people in London and other issues?
There are so many reasons why countries can differ, and that, let alone the policy. The age distribution, I didn't realise in Ireland, 6% of the population is over 75. In Italy, double that, 12% of the population are over 75. And this is a disease of the over 75s almost completely. So I think that these are all many comparisons. We're a densely populated country, all sorts of things. But there's still, and so making these fine comparisons is extremely difficult indeed. However, when you see really massive differences between countries, then it is really worth trying to investigate why. But I'm not saying why.
All right. You mentioned there it's a disease of the over 75. So let me ask you another, again, straightforward sounding question. How scared should most of us be of dying of COVID-19?
Yeah, it's an interesting question, because as lockdown is released, we're going to be, this is turning from essentially a societal threat into risk management. And so I think it's very important that we are aware of what the risks are. I'm not saying how anybody should feel or what they should be worried about, but I suppose my aim as a statistician was that people's anxiety should be at least roughly proportional to the actual risks that they face. And I've been looking at some data. Do you want some numbers? Come on, I'm going to give you some numbers. Whether you like them or not. Right. So Office for National Statistics had reported nearly 30,000 COVID deaths up to April the 24th. OK, let's look at a young group. People are anxious about children. Now, there's 10 million under 15s in England and Wales. Now, how many of those have died and had COVID on their death certificate out of these 30,000 who have died with COVID?
Tell me.
2 out of 10 million. Now, and it's very tragic cases. I suspect they might have had something else wrong with them. OK, so that's 2 out of 10 million. This is the tiniest risk you could ever think of. And so I do think that when people start talking about protecting our children, this is a bit of a delusion. Obviously, I'm talking about risks to the individual themselves. We have to think about the potential for spreading the virus, and that's absolutely vital. But when we're talking about personal risk, for young people, it's staggeringly low. If you look at under 25s, there's 17 million of them in the country. We have had 26 deaths recorded. Again, many will have had other conditions. That's still just 1 or 2 per million. That's about the risk we face in over a couple of days of general accidents and sudden death. So this, again, is completely trivial. Let's compare it with the over 90s. No, more than 1% of the over 90s in this country have so far died from COVID, just in 4 weeks, essentially. So that's a substantial proportion. That is 10,000 times the risk of the younger people. Now, it's very difficult to communicate that staggering gradient in risk. You can start talking to people and say, well, the risk doubles roughly every 6 or 7 years. And so you can just see it multiplying up and multiplying up. But it's my job, people like me, to try to do this.
So we're talking about the over 70s and the over 75s. A lot of this is about how well the communication is done. And we're now very familiar with these daily press briefings. How well are they working, do you think?
Well, I watched yesterday's, and frankly, I found it completely embarrassing. We get told lots of big numbers, imprecise numbers of tests being done, 96,878. Well, that's not how many were done yesterday. That includes people that were posted out. tests that are posted out. We're told 31,587 people have died. No, they haven't. It's far more than that. So I think this is, actually not trustworthy communication of statistics. And it's such a missed opportunity. There's a public out there who are broadly very supportive of the measures. They're hungry for details, for facts, for genuine information. And yet they get fed this, what I call number theatre, which seems to be coordinated really much more by, a number 10 communications team, rather than genuinely trying to inform people about what's going on. I just wish that the data was being brought together and presented by people who really knew its strengths and limitations and could treat the audience with some respect.